Bill Shorten, welcome to the program.
Good morning.
So let's start with the immediate question. Is enough being done right now to protect aged care residents?
No. You know, I had a neighbour who lived 2 doors down who went into St Basil's home, and his family couldn't find out for 5 days what happened to Theo. But these 5 days were the days that the Commonwealth was running St Basil's. It wasn't before then. Then we got the phone call that no one wanted to get, that he had passed on that 5th day, the Saturday night after we'd been hitting the phones. But the Commonwealth still rang Theo's family on Sunday and said, he's doing fine. So there is a major problem. And I just want to give a shout out, though, to all the aged care workforce. There are a lot of places getting it right, David, and aged care, I think, is a disaster, but there's a lot of people.
So what needs to happen then right now?
Well, first of all, as my colleague Julie Collins has said, we should be pursuing the Royal Commissioner's suggestion of a national pandemic aged care coordinating authority. The government set up a response unit in Victoria, which is good as far as it goes, but it doesn't go far enough.
What would the difference be? Because we just heard the PM saying what they're doing with these state-based response centres is adequate. Can you explain what difference would a national body make?
Well, first of all, clearly the left hand doesn't talk to the right hand in government bureaucracy. I mean, we've got staff who need PPE training, personal protective equipment training. We also need to make sure that personal protective equipment is provided. And also, I was listening to what your panellists were saying beforehand, the reality is that the government introduced a retention bonus, but it's not going to all of the people working in aged care. So what that means is we've set up an industry for 20 years, ever since Howard helped privatise it, and in order for the low-paid casual workforce to make enough money, they've got to work in multiple centres. They're not getting the support. So a coordinating authority, I think, deals with all of the issues.
OK, but just to be clear on this point, can't state-based response centres deal with those issues? Are you saying they're unable to?
It'd be good if they can, but if you set up a Royal Commission and the Royal Commissioner makes a direct intervention, why are we second-guessing it? Why do we leave old people, elderly people and vulnerable people with a second-class system? The people in the system are working hard. But this has been the dirty secret of Australian politics, and COVID-19's just revealed it.
Well, what does it reveal? What's the bigger picture here, Bill Shorten? You refer to the privatisation of the sector. What are you suggesting?
How on earth can you ensure that... How can you serve two masters? How do you serve the master of profit, making a profit, and care? And this is the problem. Looking after elderly people with diagnosis of dementia is not cheap. So if we want to make a profit and you want to look after people, then you create fault lines in the system. COVID-19, right across Australian society, has revealed things which have been glossed over. But if you're a worker in this system, and there are great people working in this system, they're doing the hard and the tough work, they have to work at multiple centres just to make a living.
So are you saying there should be no profit-making in aged care?
I'm saying that we need to put people before profit. I'm saying that if you can make a profit, that's good. But the problem is here that we're seeing profit being made, but people not getting looked after.
But when you just said you can't serve two masters,
You've got to make a choice. In a beauty parade, you've got to make a choice who you want. And I want us to look after our elderly Australians.
But you're not saying there's no place for profit?
No, but I am saying that what we see is the system relies on the workforce who get paid crap, who have to work at multiple centres, who are casuals, and we expect them basically to do what governments are not prepared to do, which is take up the load.
What's the answer to that? I mean, we've got a huge number of unemployed now. We've got a demand for care workers, not just in aged care, but disability care, and we'll get to that, childcare and so on. What's the answer here? How can government fix both problems?
Well, I think from every crisis there's an opportunity. We're still in stage 4, so talking about opportunity in Melbourne sort of seems a bit like waiting for a sunny day. But we've got the opportunity to pay people properly, train people properly, put more money into aged care. Don't rely on a casualised workforce who, whilst they do the work of angels, are effectively treated like fruit pickers. We've got to stand up and say that if we care about our parents and our grandparents, which we do, and most Australians would agree with that, you can't do that on the cheap.
Let's talk about disability care. There are some growing concerns about the numbers that we're seeing there in terms of the virus. And a lot of similar issues when it comes to casual workers, the need for training and access to personal protective equipment, masks and so on. There are 89 active cases now in Victorian residential disability accommodation. 67 of them are staff, 22 are residents. I understand the Victorian government has been requesting these sort of state response centres like we have now with aged care for disability care. Instead, the Commonwealth hasn't agreed to that, but the state has set up its own one. It does have NDIS representation on it. Is that adequate?
Well, first of all, I'd like the health authorities to report the number of people with disabilities who are actually dying from COVID. The Victorians have got some data, but I think that's a federal responsibility. I don't think it is adequate enough. Did you know, for example, that disability carers often have the same skills as aged carers? The UK showed that 2/3 of people who died there had a disability, yet disability carers can't even get a retention bonus. So the very problem that we're identifying as a trigger in aged care, low-paid casualised workforce, forced to go to work in multiple centres, that's happening in disability right now. There's 720 group homes, and there's a simple solution. Rather than asking a single organisation to either force their workers not to get a lot of money, is we should look at it as a sector-wide workforce. So facilities who don't have the disease and the virus can at least tap some of their workforce to help out rather than putting
hasn't that happened?
Untrained people in.
The Minister, Stuart Robert, did put out a press release this week saying that they've made 4 large providers, they put them on standby to provide workers, to provide accommodation for the smaller
Yeah, that is a step in the right direction.
So what needs to happen right now then for disability care?
Well, what I would do is, first of all, I would give disability workers the retention bonus. I'd make sure that we had pandemic leave for them, and I'd also make sure that we think of disability like aged care as a whole sector, and that we use all of the resources rather than asking individual organisations when there's an outbreak to handle it on their own. I mean, when you think about aged care, it isn't just to be expected, and I don't agree with Mr Morrison. Do you know we're the second worst in the world now in terms of COVID-19, proportionately, and aged care? That is not the country we see in the mirror, we want to see in the mirror. Second worst in the world.
Let me ask you a few questions on the economy.
Sure.
There are, as mentioned, a lot of unemployed, more than 1 million as of the jobs figures this week. Do you think the rates of JobKeeper and JobSeeker should still come down in about 6 weeks?
Absolutely not. I got an email last night from a lady in Ringwood, Rebecca, who knew I was going on the show today, and her story speaks why we shouldn't be cutting JobSeeker and JobKeeper at the moment. She said she's a mother of 4. She will lose $1,200 a month as soon as the reduction comes in. I live in Victoria. It's pretty bloody obvious that we should be extending JobKeeper and JobSeeker into the next year. And I also want to give mention sole traders and partnerships are slipping through the cracks. Small business. You'd think with Morrison, Mr Morrison, they're his heartland, so he says. They're missing out, and casuals are still getting a raw deal.
Well, Labor's position, as I understand it, is they should consider maintaining the rate of JobKeeper and JobSeeker. You're saying this morning they should be maintained.
Labor will arrive at its position, but as a Victorian, I see the hardship. You know, in the city, in the Block Arcade, beautiful, iconic arcade, 7 or 8 small businesses probably aren't even coming back. Well, the problem's real. And if we know that we're going to have to maintain JobSeeker and JobKeeper, and JobKeeper has, on balance, done more good than harm.
Sure, but
let's just get on with it.
Just in your comment there, are you suggesting that Labor's taking is a bit slow to get to that position?
Not at all. I think Labor has been ahead of the government on a range of issues. Paid pandemic leave, what to do in aged care. And Jim Chalmers has made it very clear, our Shadow Treasury spokesperson, that the modelling on JobKeeper was based on there being one spike. Well, as John Maynard Keynes, the economist, says, as the facts change, so does his opinion.
If you'd won the election last year and you were leading Australia through this crisis, what sort of reforms would you be looking at to get people back into work, to grow the economy?
Well, we didn't win the election, and Labor will unveil all its policies in good time before the election. But I think COVID-19's actually changed the way we do things in Australia. COVID-19 has shown, I think, and there's been plenty of people, plenty of views, this is just early thoughts when you're locked down, you have time to think. Aged care is a basket case, not for the people in it, but for the lack of support it gets. Childcare, why are we making childcare workers, for example, not be able to get JobKeeper and create some second system? There's no doubt in my mind it's highlighted inequality, The people who are doing it worst under COVID-19 are the people who rely upon income, who don't have a whole lot of property assets.
Has it changed your thinking on tax at all?
Well, I don't think that COVID... Well, I think in IR, it reinforces some of what I thought, which is that we've relied on a 70-30 split in our workforce. 70% permanent, 30% casuals. The casuals are the ones copied in the neck. Probably what it has made me do is realise that sole traders and partnerships don't fit neatly into a whole lot of government programs. And I would, that I think is worth a lot more creative work. The other thing, though, which I'm absolutely even more redoubled in my conviction, is manufacturing. We've run out of items in our supply chain. It's about time that we double down our investment in making things here.
Just on that, some suggest we need to do more on gas to make manufacturing more affordable, even taxpayer subsidies for infrastructure when it comes to gas. What do you think?
I think that if we want to transition to more renewable energy, we still need baseload energy, and that gas, I think, is part of that answer. As formerly a union rep, I used to look after workers in manufacturing. You can't have a manufacturing sector from Qenos and Botany and Altona through to foundries, through to the 4 smelters in aluminium, the steel industry, unless we have low-price energy. I think gas does tick some of those boxes.
Okay. A couple of quick ones.
Sure.
On the Ruby Princess, Brett Walker found in his report on Friday that the Australian Border Force, and for that matter the Department of Home Affairs, do not bear any responsibility for the Ruby Princess mishap. Do you accept that?
Well, I haven't read the report, but I've seen the media coverage. It certainly does make it clear that Brett Walker sheets a lot of the responsibility to New South Wales, Berejiklian and government health representatives.
Is there any evidence that Border Force did anything wrong here?
Well, I don't know. And the point is, it would have been good if Mr Morrison had allowed his federal officials to give evidence. So,
what about in Victoria, as you mentioned? We're here in stage 4 lockdown at the moment. How would you rate Dan Andrews' handling of the virus?
I think Dan had been doing a pretty good job, and when we've had the problems that we've seen in Victoria of hotel quarantine, say what you like about Dan Andrews, he fronts up every day. He shows what I think a leader should do. He takes the questions, for better or for worse.
Does he answer them, though? Are you satisfied with the explanations that have been given?
He's set up the Coates inquiry. I think we'll get to the bottom of it. But I noticed that the federal government always seems to be out there blaming the states. I brought this book along today. It's called The Constitution. I'd like Mr Morrison to read it. It's sort of like his job description. And if he doesn't want to read the whole lot, Section 51, which I have open, sets out like his day job and his powers. People mightn't realise quarantine is a federal government responsibility. It's at Section 51 sub 9, so...
Well, Section 51 of the Constitution, seeing as you've got it there, it says the Parliament shall, subject to the Constitution, have the power to make laws for quarantine. It doesn't say it's responsible for managing hotel quarantine, does it?
Well, if it says quarantine in the Constitution, at the very least...
So you're saying the current arrangements are unconstitutional, where the states are
I guess I'm saying that...
hotel quarantine?
From Shorten QC to Spears QC, talking constitutional law, I'm saying that the federal government has some role in quarantine, and I think people just want to see the system run properly, not get into the blame game.
What role are you talking about there? What should the Commonwealth be doing with hotel quarantine?
Well, the Commonwealth is the big dog of Australian politics. It's the biggest player.
So what should it do here?
I think they should be doing as much as they can, working with the states to keep people safe.
What specifically should the Commonwealth be doing with hotel quarantine that they're not?
Well, I think that they should be providing as much knowledge and capacity working with the state government. My point is very simple. Mr Morrison, unlike Dan Andrews, doesn't, stick around for the tough questions quite often. And I think when it comes to quarantine, we've heard about Ruby Princess, we've heard about hotel quarantine. The feds have got a job to play here.
Final question. Can I ask you about the Afghan soldier, Hekmatullah? Who murdered 3 Australian soldiers back in 2012. He's now going to be freed, apparently, from jail under a prisoner swap agreement. The Prime Minister says he has written to President Trump about this. Is there more Australia should be doing?
This is a terrible story. Hekmatullah turned his rifle on 3 Aussie diggers and killed them in cold blood. The Americans have captured him, which is a good thing. This is where I probably think Malcolm Turnbull, even though I disagree with him on a lot, certainly I thought did a better job standing up to Donald Trump. On this matter, I think that the families of Australian diggers who were murdered in cold blood should know what the government's doing. We all should. I don't think our closest ally, militarily, should be releasing a Taliban gunman who killed 3 of ours. Just let him go scot-free. I think we need to do more, and it needs to be transparent what's going on. Or fundamentally, if I can put it in really plain English, Mr Morrison needs to make sure that he doesn't look like he's just a simp to Donald Trump on this very important issue.
Just explain simp.
Well, soft.
Bill Shorten, thank you.
Cheers.